You don't want to get older and regret some of the things that happened to you when you were younger. You don't want to have things like stress, anxiety, ADHD, bipolar, depression define who you are. You don't want to be labeled as somebody who has a disorder. This is what some of my patients regret the most. As a board certified practicing family doctor for the last 13 years, I've seen so many patients and I've seen so many people be stressed out. And when they're stressed out, they're trying to fix themselves, overcome their thoughts, and trying to fight their emotions. Instead of calling it a disorder, say that you want to embrace and accept anxiety. You don't want to have a problem at a red light, do you? You want to stop at the red light. You don't want to overcome the red light. You don't want to fight the red light. You don't want to beat traffic. You want to accept and embrace traffic so you don't get in a car accident. What is that? You're using your anxiety to your advantage. Do you have ADHD? Well, put the phone down and just drive. That means you're doing one thing at a time. Do you have bipolar? Why don't you try to accept your environment instead of trying to control your emotions? Some of these things will lead to you having a much more fulfilling life. Imagine if you were to write these things down. You say, I don't have anxiety disorder. I'm not stressed out. I just haven't utilized the proper resources that we have in our country. I have not seen the doctors, the therapists, the people that are looking for solutions. Let me go find them so I don't have a heart attack, a stroke, or I have a big medical problem when I get older. What happens when you get stressed out is that people try to control their mind. People try to block things out or try to be strong or be positive or negative. These are some of the biggest problems that I've encountered as a doctor because when you just accept who you are and when you write it down, I'm accepting who I am. I am compassionate about myself because I ate 1% less today. I went to the gym for 1 second today. I have developed compassion for myself. When you do these things, you're labeling. You're not viewing your life as being anxious or depressed or having ADHD. You're not considering you have a disorder because you're labeling it and you're doing something about it. Medications do work. I'm a medical doctor. I prescribe medications, but you have to understand that we're the drug dealers. That's why we have to sit down and be able to educate our patients and inspire them and say, look, this is what happened to me. When I was younger, I was trying to overcome my emotions. I was stressed out. I was burnt out. I almost died from alcohol and drug use. I've been sober for almost 7 years. As of July 30th, 2025, I've been sober for 7 years now. I don't want people to go through the same thing. It's not only as a doctor, as a patient, I've experienced this too, where I went to rehab, where I was off of work for almost 6 months because I just did not accept and embrace who I was. I thought I was dumb. I thought I was stupid to a point where I've even written a book called The Dumb Doctor. But what really helped me was the writing techniques, mindfulness based cognitive techniques, dialectical behavioral therapy, eye movement desensitization reprocessing therapy. I've taken a lot of medications too, but medications have caused me problems. But in addition to these things, if you were to write, you have a 30% reduction in your symptoms of anxiety, ADHD, bipolar. These this is just a different way to look at it. And this is not only me coming to you as a board certified family doctor, it's coming to you as a patient who's seen so many doctors, therapists. I've had 50 coaches in my life, and I'm just trying to give this back to you. What can you do right now is that you can write and you can label an emotion and accept it and embrace it and do your best to feel good by doing the next best action step. Namaste.